Alrighty, welcome back to another episode of Patriot Network TV. Real quickly, Thursday night, April 15th, the Tea Party. Taxed enough already? In this locale, right here in beautiful Prescott, Arizona, where it is another gorgeous day, sunshine dripping down. Got up this morning, had to scrape all the beautiful sunshine and warm weather off my windshield. It was just terrible, devastatingly difficult. 8 foot of snow in the last week in California. Have you seen these stories? Apparently up there at Donner Pass, they've gotten 96 inches of snow. At least that's what they said on the news. Of course, you know how the news lies too. So Thursday, courthouse here in town. Taxed enough already. Charlie Gullett, my good friend, will be speaking, and I will be speaking, and we're going to go through all the data. We're going to talk about how a year ago, if we would have told you what it looked like today, you would have never believed us. And of course, what's the implication? What's it going to look like a year from now if we don't act by November? Now, I want to talk to this healthcare, especially the unintended consequences of this healthcare bill. There have been 2 very, very disturbing stories in the news, and I want to cover both of these stories real quickly. The first one is the story of poor Diana Schmidt, and she is a woman who was getting healthcare paid for by Medicaid or Medi-Cal, and basically indigent healthcare, and she had cancer, and she was taking chemotherapy, and she was taking the radiation therapy, and she was waiting for a transplant. Without a transplant, she will die. There's no discussion, no nothing. She'll die without it. So Social Security calls her and says, oh, by the way, would you like disability? Would you like, her son, who's 12, 13 years old, whatever, he qualifies for disability, and we'll send that to you. So she says, sure. Poor woman's been going through chemo. She's waiting for a transplant. Her health, she's hanging on by the fingernails to see if she can live and take care of her son. So, and the important part about this, she didn't contact Social Security. Social Security contacted her. They recruited her. As soon as the disability payment came in, they said, no, now you make too much money. We can't give you the transplant. At this point, she said, like any normal average American would, I'll give you the money back. What did they say? No, we can't. We can't take it back. Now, Mr. Obama went around libeling and slandering doctors. In the written word, he said that doctors were no good and they'd cut people's feet off just to make money, or they wouldn't give you antibiotics because they want to cut out your tonsils. Libeled the doctors and slandered the doctors. Now, I take this really personally. 2 of my very best friends on earth are physicians. Now, first of all, they had to work dog bone hard to get an undergraduate degree in natural science, and then they had to go through med school, then they had to go through residency, and now they got to fight every single day to make a living to take care of you. That's what doctors do. Now, is there a bad doctor out there? Sure. I'm, like anything else, 1% of the population of, 1% of the snail darters are no good. 1% of the docs probably aren't any good either. But by and large, the doctors in America that I have direct experience working with are the greatest people that you'd ever want to meet. And for the President of the United States, who should be a cheerleader for free enterprise and for opportunity and for professional growth, he should be out cheering those folks on, talking about, we've got the template ought to be, we got the greatest medical service in the world, we got the best doctors in the world, we've got the best medical education on earth. Instead, he's out there slandering the doctors, libeling the doctors, saying in effect that they're just money grubbing, no good SOBs. Now, he made the healthcare push. The very last surge was made on, look at what these evil doctors and evil hospitals and evil insurance companies are doing. They're denying claims. Medicare and Medicaid deny more claims because they're so big than any 3, 4, 5, 10 insurance companies in America put together. And at the time, go back in time magically, Sherman set the Wayback Machine for 4 months ago. People like me were doing shows like this warning you that there will be. Medicare and Medicaid will refuse. The bureaucracy itself will fail. Now, this is not because people like me are smart, nothing like that. People like me understand bureaucracy. Bureaucracy is not evil, it's not venal. The problem with bureaucracy is nobody is your champion. The reason that the private sector can thrive, the reason that individual entrepreneurs have an opportunity in this country to create new products and services is if they are on fire with their ideas, they will be allowed the freedom to succeed. When you go to work at a bureaucracy, no one, and I mean no one, over time has that attitude, because the bureaucracy grinds off all your sharp edges. The bureaucracy grinds away your initiative. It grinds away at you. And you know what you learn after a while working in bureaucracy? Paper comes on my desk and I just want it to go off my desk as quick as possible. Ronnie Gottlieb, a great old Democratic strategist who taught me a lot about how the U.S. federal government operates. One time I was trying to get a project done. This is 1984. I'm back in Washington, D.C. I'm working with the Commerce Department. Ronnie Gottlieb comes into my office and said, no, you're doing this all wrong. Your job, Terry, is to get the turd off your plate. Your job is to put your turds on somebody else's plate. That's what bureaucracy does. I understood at that instant that you could not have the U.S. federal government run any program where there was critical care being delivered, because at some point it's all about getting the turd off your plate. Back to poor Diana. What happened to her? She's standing there ready. She's been through her chemotherapy. She'll die without the transplant. And what do? Another government agency that the left hand doesn't know what the right hand's doing comes in, gives her enough money to put her over some critical barrier. Now she is going to be murdered. They're going to engage in a process of statistical murder. More people will die if they follow their policy than if they don't. And what's going to happen to her little boy? He's going to be orphaned. He should be the poster child for our fix of the medical system. The first thing we need to do is strike this bill down. This little boy, and you don't see, Mr. Obama drug out every poor person and drug out their poor orphan children and see what these evil doctors and evil insurance companies have done. Where is he now? Where is he now signing an executive order saying, hey, we can't possibly let this poor woman die. We can't have a death panel effect. Just from the standpoint of not letting my critics say that there are death panels in place, I'm going to immediately sign an executive order and we're going to reach out and we're going to save this poor woman's life. I don't hear that. Do you hear that? What I hear is the sound of silence. What I hear is H.L. Mencken's warning that the road to hell is paved with good intentions. What I hear is Milton Friedman screaming to us from the grave, nothing is so dangerous and so evil and so venal as a bureaucrat with power and good intentions. We need to get this bill repealed. We need 75 seats minimum in the House of Representatives. We need 12 to 15 seats in the U.S. Senate. We need to send a message. If that doesn't work, we're going to have to stop paying federal taxes and go to jail. Thursday night, the Tea Party. Get to it. Stand up. Be counted. Tell them that you're mad as hell and you're not going to take it anymore. Get out and enjoy the day. I'll talk to you soon.